Activity and Exercise Part 2. This is a variety of nursing diagnoses that may be utilized for someone who has impaired physical mobility. You need to develop goals and expected outcomes to assist the client in achieving his or her highest level of mobility and reducing the hazards of immobility. Set your priorities when planning care to ensure that immediate needs are met first. Plan therapies according to the severity of risks to the client. Individualize the plan according to the client's developmental stage, level of health, and lifestyle. Nurses often delegate some interventions to nursing assistive personnel, and physical or occupational therapists, when it's essential, need to be considered if mobility needs are evident. Make referrals or consult a case manager or a discharge planner to ensure that the client's needs are met at home. The actions of walking, turning, or carrying are all common nursing activities that require the use of muscles. To reduce the risk of injury, nurses need to comprehend and practice proper body mechanics and remain knowledgeable of current research standards and guidelines concerning safe transfer and positioning techniques. Activity promotes healing by increasing circulation and strength, decreasing respiratory complications, increasing gut motility, which improves bowel and genitourinary function, and it also improves mental function. Physical activity maintains and improves joint motion, increases strength, promotes circulation, relieves pressure on skin, and again improves urinary and respiratory functions. Physical activity also benefits a client psychologically by increasing social activity and mental stimulation and providing a change in the environment. It plays a crucial role in a client's rehabilitation. To prevent injuries, you need to know the appropriate ways to lift and carry things. You need to include a variety of interventions such as education, prevention, and early detection of work-related musculoskeletal injuries. Most of these injuries are going to occur as a result of overexertion or improper body mechanics, which results in back injuries and other musculoskeletal problems. Back injuries, again, are often the direct result of improper lifting and bending. If the client is immobile, initiation of range of motion exercises may be indicated. Range of motion exercises are a passive activity exercise in which an external force is applied to a muscle to make it move. And it helps the client maintain some muscle tone and circulation. Bone health in patient with osteoporosis requires early evaluation, consultation, and a team approach, especially when they become immobilized. ADLs will help a client maintain independence, so we want to try and keep the patient at the point where they can complete their own ADLs. When moving a client, you need to be aware of whether the client can or cannot help you, and you need to prepare for appropriate assistance if that client is unable to help. Body mechanics is going to be the coordinated effort of the musculoskeletal and nervous systems to maintain balance, posture, and body alignment during lifting, ending, moving, and performing activities of daily living. It also facilitates body movement so a person can carry out a physical activity without using excessive muscle energy. The nurse is going to prevent injury by using correct posture, minimal muscle strength, effective body mechanics and lifting techniques, and appropriate lift devices. Client safety is observed by appropriate lifting techniques and lift devices and making sure that there is adequate staff. So to observe appropriate body mechanics, you need to make sure that you keep the weight to be lifted as close to the body as possible. The best height for lifting vertically is approximately 2 feet off the ground, and keep the weight close to the lifter's center of gravity. The person that has the heaviest load will coordinate the efforts of the personnel involved in the lifter transfer, unless the cervical spine is having to be maintained in a neutral position. Then the person in charge of the head will direct the movement. Always place a foot in front of a client's feet when standing the client, and use your knee to help stabilize a client's weakened or paralyzed leg. The wider the base of the support, the greater your stability. The lower the center of gravity, the greater your stability. The equilibrium of an object is maintained as long as the line of gravity passes through its base of support. Dividing balanced activity between the arms and the legs will reduce the risk for a back injury. Leverage, rolling, turning, or pivoting will require less work than lifting. When you reduce the friction between an object to be moved and the surface that it's being moved on, it requires less force to move it. Different types of muscle contractions involve isotonic exercises. Isotonic exercise enhances circulation and respiratory function. It increases muscle mass, tone, and strength, and stimulates bone-forming cells. This includes walking, swimming, dance aerobics, jogging, bicycling, and moving the arms and legs with a light resistance. Isometric exercises will increase muscle mass, tone, and strength, enhances circulation, and stimulates bone-forming cells. These are quad set exercises where the gluteal muscles are contracted. They're ideal for a bedridden patient. Resistive isometric muscle or exercises will promote muscle strength, mass, and tone, and also will stimulate bone-forming cells. These include push-ups, hip lifting, or pushing the foot against the footboard of a bed. When we are trying to improve mobility, we need to make sure that the client has a diet that's high in protein and calories, and also high with vitamin B and C supplements. This will help repair damaged or injured tissues and help rebuild any depleted stores. Vitamin B is needed for skin integrity and for wound healing. Respiratory toilet will help assist the client in lung expansion and keeping their airway cleared. This can also include chest physiotherapy, where there is percussion on the client's chest or back, and positioning to help secretions in the lungs drain. This helps clear the airways and helps prevent pneumonia. It also includes your turn cough and deep breathe. Cardiovascular. Immobilized clients, again, have that increased workload on the heart, and they can experience orthostatic hypotension, and again, the decreased movement where the blood is not circulating as well can lead to the development of blood clots. When initiating movement with a client, we progress from the bed to the chair and then to ambulation. Things that may also help with circulation on bedridden patients or patients that are not moving around as much as they should be would be your sequential compression devices, your TED hose, and leg exercises. Musculoskeletal, performing range of motion for the client where they assist you or you do it all for them. Of course, it's better if they can help, but if you can give them support while they move the joints, that's ideal. The CPM machine is a machine that the client's leg is placed in and it causes it to bend. These are often used after a client has had a knee replacement. Active range of motion, sequential compression devices, TED hose, all of these will decrease the incidence of hazards of immobility. With restorative and continuing care, the goal of restorative care for the client who's immobile is to maximize their functional mobility and independence and reduce residual functional deficits such as impaired gait and decreased endurance. We want to get them as independent as possible. Unfortunately, it may not be back to the level that they were prior to the illness or trauma, but we want them to get to maximize their independence as much as possible. Instrumental activities of daily living, or IADLs, are activities that are necessary to be independent in society that go beyond the ADLs and include skills such as shopping, preparing meals, banking, and taking medications. If you do range of motion exercises, you need to make sure that you support the joint. Walking is going to be the best restorative exercise out there. It increases joint mobility and strength. To prevent complications with the integumentary system, make sure that you reposition the client every 1 to 2 hours and provide good skin care. With the elimination system, to prevent complications, make sure that adequate hydration is provided and serve a diet that's rich in fluids, fruits, vegetables, and fiber. This is a picture of the sequential compression devices. The TED hose, or the anti-embolic elastic stockings. They can be knee highs or they can be thigh highs. These should be very snug but not constrictive. Make sure there's no wrinkles on them. If you're applying them to an injured limb, you need to do it very slowly and carefully because it is very painful. These are positions that you need to be familiar with, the terminology, supine and prone. These are other positions that you can place clients in: the Sims position, the knee chest position, and the lithotomy position. And know the appropriate times for clients to be placed in these positions. Notice the client in the Sims position is being supported with pillows. The Fowler's position, the semi-Fowler's position, and the high Fowler's position. Know when these positions are appropriate. The Trendelenburg position is commonly used in clients that need to have their blood flow directed towards the brain and the important organs. We often do this if a client is going to have a subclavian catheter placed, because it will fill the veins in the upper chest better. And also if a client is having problems with very low blood pressures, we'll put them in the Trendelenburg position. And then you have the reverse Trendelenburg position, frequently used in surgical or a variety of surgical procedures. The orthopnic position. If you see a client that has chronic obstructive pulmonary disease or COPD, the emphysema or bronchitis, etc., You often see them in a position where they're leaning forward. These are the patients that sleep better sitting in a recliner, or you see them on the bedside in a tripod position. The forearms are placed on an overbed table, or they're placed on their knees, forming that triangular or tripod position. It just enables them to breathe easier. Know how to use your different positioning aids and how to instruct the client to use different positioning aids. This is a trapeze bar that the client can lift their upper body with. And on the right side, you see a trochanter roll, which will prevent the client from rolling too far. If your facility has mechanical lifts, make sure that you know how to use these appropriately and that you do use them when it is required to move a client that is unable to stand on their own. These aids can actually move them from the bed to a chair, or can help them stand to help gain some strength in their legs. Excuse me. Determine a client's ability to assist with transfers. Allow the client that can move to the stretcher on their own to do that, and stand by to make sure that this transfer is done safely. If the client cannot assist or can only assist partially, use a friction reducing device such as one of these boards. Use your appropriate resources. If the client weighs more than 200 pounds, then you need to have at least 3 caregivers to move them. Before moving the client, make sure the stretcher and the bed are side by side. These transfer boards, again, are these friction reducing devices. They should also be used if a client has a suspected or a confirmed spinal cord injury. You log roll the client onto the board, keeping their spine in a straight line. When you're getting ready to move a client onto a stretcher or a bed or a slide board, etc., you prepare them by asking them to fold their arms over their chest so they're not reaching out and grabbing you and their arms are not getting in the way and increasing the risk for injury. So when you evaluate the client for mobility, were the goals met, or is there more work required? From your perspective as the nurse, you need to evaluate the outcomes and the response to the nursing care and compare the client's actual outcomes with the outcomes selected during the planning process, such as the client's ability to maintain or improve their body alignment, joint mobility, their walking, moving, or transferring. Once these questions have been asked and you've addressed the limited mobility and its associated problems through the client's eyes, then adjust the plan of care as necessary to address the remaining clinical problems that your client might be experiencing. If you look at figure 4727, you will find a critical thinking model for immobility evaluation.